Mental illness knows no barriers. It affects people of any social class, age, and sex. Here in Edmonton, the Primary Care Network recently reached out to a local psychiatrist in order to support the Southeast Asian community.
Look, we're looking for someone who can speak the language. What languages do you speak? Can you provide consultation to our GP clinics? So it suddenly all fell in place.
Being Southeast Asian himself, Dr. Gupta is able to use his cultural knowledge to connect and relate with patients.
They walk in and they see somebody who can talk to them in their language. They're surprised. They're pleasantly surprised. It's so obvious from their expression. And when I start talking to them in their language, they are more willing to talk about things. If the person who's providing the assessment or the treatment, if that person does not understand the cultural aspects, the subtle issues, then they cannot necessarily do a meaningful assessment.
According to him, relying on their own cultural experiences assists the doctors to be able to relate to patients and their specific needs.
It's about being able to understand what is it that they are trying to convey without actually putting it in words.
Recently, Dr. Gupta saw a patient who was retired from a life in Indian politics and now staying with his daughter in Canada. Worried about his isolative tendencies, she brought her father to Dr. Gupta.
I'm not depressed. I can go out, but what do I do? Where do I go? It's cold outside. There is ice, there is snow. I don't want to slip. If it wasn't a psychiatrist who understood the culture, who understood these issues, they may have said, yeah, this guy's becoming depressed. And that's where it is important to understand those family dynamics, understand where are they coming from, understand what goes on back home.
Other common cultural stigmas include:
what will my neighbors think if they find out he's on support? What would others feel like? And it is not just because it is the stigma, it is also the paranoia about the new culture. How is the new culture going to treat them if they come up with problems?
To access the mental health programs at the PCN, one can receive a referral through their family practitioner. For more information on the services offered, please follow the information on your screen. In Edmonton, I'm Bianca Jade.